talk about things like cancer risk, heart disease risk, dementia risk. All of those things, they may not have affected you until you are done with reproduction, when you're done with family planning, right? And so if we can find those things before you actually have children, while you're going through this process, before you're going through this process, then we can take steps to weed those things out.
Welcome to the Egg Whisperer Show. I am delighted to have Dena Goldberg on today's show. Welcome, Dina.
Thank you so much for having me. The
title of today's show is A Genetic Counselor Shares What Fertility Patients Need to Know About Genetics and Hereditary Disease with guest Dena Goldberg. She is the founder of Malibu Genetics. That sounds lovely, actually. She is now known far and wide as Dena DNA. It sounds like you knew you wanted to be a genetic counselor from a very young age. Tell us more about your history.
I wanted to work with genetics since I was really young because of my little sister. My parents are both doctors, so I knew I'd be doing something in this area. So I originally wanted to work with families who had a child with a disability like my sisters and help them get connected to resources. And I was doing research in cancer and then went on to grad school. It just so happened that the way everything worked out, that I got this amazing position at UCSF, and I became really interested in helping all sorts of people with their cancer risk. And how that genetic testing works in the medical clinic is that sometimes it's kind of siloed. And so I decided to open Malibu Genetics, which I'm glad you think it sounds lovely, because that's, I want it to be more of this like luxury concierge service to be able to help one individual with all their genetic testing needs at once, instead of just focusing on one specialty at a time. And so I had decided to do that. And at the same time, I was going through my own fertility treatments. I'm still on this long journey, right? I realized after going to a bunch of consultations that not everyone is like you and asks about family history. And I have seen countless patients who actually have a hereditary syndrome that would affect them later on in life that they were not aware of and that was not really asked about in fertility consultations. And so they went on and they did IVF when if they had known about these syndromes, they could have done something like PGTM, which we're going to talk about, I'm sure, later. That to me felt like there was this missed opportunity to really help a lot of people understand what genetic testing needs to be done before they go through this journey. That's kind of what inspired me to start working with fertility patients as well, because I think, there's a lot of emphasis on embryo genetics and on different like prenatal genetics, but we don't talk a lot about adult onset conditions and how that can affect IVF.
I love what you're doing. So thank you for educating my patients, because we have a lot in common now. So thank you so much. So what are the different types of genetic counselors?
So a genetic counselor is a master's trained professional, then gets board certified. And we are trained in all areas of genetics, meaning from pre-birth through death. There are genetic counselors that can help you at every step. So pre-birth, when I say that, it's preconception. So planning a pregnancy, family planning. And then there's prenatal, which is when someone's already pregnant. And then there's pediatric, which is when a child's born or a child develops some sort of disease and needs help getting a diagnosis or resources. And then there's adult onset conditions like cancer, cardiology, neurology. There's all these areas as an adult that you can have a risk and that we can find the risk and figure out how to lower it. And so there are genetic counselors that work in all of those specialties.
And why should someone see one?
Yeah, so the main reason usually is because someone has a personal or family history of a disease, and they want to understand if it is something that runs in their family or that they can pass on. But there's a lot of other reasons too. So for instance, like a prenatal genetic counselor may see people who have abnormal ultrasound findings or who are worried about the way that some exposure may affect their developing fetus. But then there's also this new area that I'm really interested in, which is more proactive genetic testing. Not everyone knows their family history, right? Some people are adopted, some people were donor conceived, some people's family just don't talk about health issues. And so there's this new kind of category of proactive genetic testing that's looking at some of the most common hereditary conditions and helping people understand if they have one of those, because family history doesn't always tell us everything.
And some tests that people do as consumers would be things that people assume might test for everything and they don't need to do more. And I'm referring to tests like 23andMe, for example. And so I see a patient, I said, I'd like to do carrier screening. They're like, oh, I did 23andMe and I'm fine. Does that screen for what patients need to know?
Great question. That is literally the most common thing that I get asked, that and BRCA. And the answer simply is no, not at all. So the technology that's used in a test like 23andMe, it's called SNP testing, and it's really only looking at very specific bookmarks on very random genes. And when we're doing health testing, it's really important that we understand if our genes are functioning. And we know a lot about a whole handful of genes. And so when we talk about carrier screening, you need to do sequencing. You need to be looking at the genes. You need to be looking at all of the areas we know can have mutations and not just random bookmarks. There's a lot that's left out, and there will be a lot that gets missed from 23andMe. So it is not at all a carrier screen and should never be used to make medical decisions, because anything that's positive should be confirmed anyway with the medical test. So, yeah, short answer no, it is not a medical test in any way.
Okay, so let's now get into what fertility patients should know. So, anyone wanting to grow their family, what is hereditary disease and when do parents need to be concerned about it?
The first thing that most fertility clinics are testing for, and they really should all be testing for this, are the recessive diseases, right? So we kind of think of these as kind of invisible in a family history, because a lot of times you are a silent carrier. You carry a condition and you don't know you carry it until you have a child with somebody else who also carries that condition. And then you both pass down non functioning copies of those genes. Typically, those people won't have a family history, so because of that, everyone should be at least offered carrier screening. And it should be a pan-ethnic panel. So it used to be that we would test people based on what their reported ancestry was. But what we're finding is that a lot of people don't really know their reported ancestry. And you can have a one ancestry and test positive for something that's more common in a different ancestry. So a bigger panel that includes everybody's ancestry is, and so that's the carrier screening. But what we don't always think about when we're doing family planning is a condition that is also invisible that may affect us later in life. So when we talk about things like cancer risk, heart disease risk, early dementia risk, all of those things, they may not have affected you until you are done with reproduction, when you're done with family planning, right? And so if we can find those things before you do actually have children, while you're going through this process, before you're going through this process, then we can take steps to weed those things out. And additionally, those things may affect the way we treat a person who is pregnant. So we may find that they have some sort of cardiovascular disease that was unknown because they have the genetic mutation, but they didn't have symptoms yet. And it actually could alter the way that we would do them during pregnancy or even during an IVF, egg retrieval or a transfer. So not only is it helpful for the patient, but it's helpful for weeding it out in future generations.
So, Dina, what is a monogenic disorder?
Sure. So, a monogenic disorder is a condition that's caused by a single gene change. When we talk about genetic testing, it's easy to look if we know a cause. If there's a genetic change, we know that there's a high correlation with disease for that change, versus polygenic, which is when multiple genes work together and individually have small risk but add up. And that's more complex. And we're still kind of learning about that. And that testing is fairly new. But with monogenetic or single gene disorders, there's a lot that we can do and that we understand with those conditions.
And how common are they?
Very common. At least when we're talking about these adult onset proactive conditions, it's more common than 1 in every 16 people, just given that one study. And that's only looking at really common conditions. And so when we add in rare, they're probably a lot more common.
And then what can we do when we know someone has one of these monogenic conditions?
So that's where pre-implantation genetic testing for monogenic conditions comes in, because really if somebody has a good amount of embryos, or they're deciding on which embryo to transfer, or they really just don't want to pass down their condition, they can select embryos that do not carry that condition. And I want to clarify too, because people always ask me this, is it genetic engineering? Are you engineering my embryos? No, this is just embryo selection. So it's embryos that are already made, that are already yours, that are natural, and then selecting the ones that do not carry the condition. And these conditions don't skip generations. So once it doesn't get passed down, it can't go on to future generations. So you stop at the line right there.
And one of the most common questions I get is, can you make sure my embryo doesn't have autism? So, what is that when it comes to genetics?
So, autism is actually a description of a constellation of symptoms. So, it's not an underlying condition in and of itself. So when we think of autism, we think of the spectrum. They have different sets of behaviors, and there are hundreds to thousands of genetic causes of autism. And there are a lot we can catch when we do different types of genetic testing. And then there are some we can't because we just don't understand. And there's multifactorial, meaning that many of these cases are probably caused by a combination of genetics and environment, or in other words, nature and nurture together. So it's not always testable when we think about genetic testing, but there are a good amount of cases that we can catch when we do genetic testing.
And I think what you're referring to, for example, as Fragile X or some sort of chromosomal abnormality that you can pick up.
Yes, many chromosomal abnormalities can have autism as their phenotype or as a symptom in a way, but not all of them will. And there can be the same person who has the same chromosome abnormality or genetic condition, and one may be diagnosed with autism and the other may not. So it's not exact, and we're learning a lot now. I think in the future we'll have more information, but we at least know that chromosome abnormalities are a big cause.
How does someone know if they have one of those diseases that you mentioned?
Yeah, so that's where this proactive testing comes in. So, first of all, most people who have these will have some sort of family history, but there are still people that don't, or that don't know their family history. We now have this technology to be able to test people for these really common and very severe hereditary conditions for a very low price, right? And sometimes, if there's family history, we can get it covered by insurance. If there isn't, or if someone doesn't fit criteria, it's usually no more than 250 or 350 for one of these very good medical panels. So what I recommend is seeing a genetic counselor right before you're going through family planning and asking for them to determine if there's something based on family history that needs to be tested. And then you can also ask for proactive testing as well.
I'm glad you brought that up because I feel like I have the why of my TUSHY method. So, for those who don't know what that is, it's my 5 steps to get to a fertility diagnosis, and why is your genetics. And I don't think that I have been discussing the proactive type of testing often enough. So, how common is it that someone would have something that they would find on a panel like this?
So one of the labs quotes that they found that 1 in every 16 adults has one of these conditions, which is really high. And for something, just to give an example, and this is a syndrome I know you do assess for, with this Lynch syndrome, right? The most common hereditary cancer syndrome. We know that 1 in 279 people have that syndrome, and only a few percent are aware of it. So there's like 90 something percent of people who have Lynch syndrome walking around and they don't realize it. And I've seen patients go through fertility, go through the whole IVF process, have a bunch of kids, and then find out they have it. And had they known earlier, and they had enough embryos to do PGTM, they could have selected embryos that didn't have this mutation, therefore ending it there, right? And not passing it down. And that's just an example of one of the syndromes, but there are a whole bunch.
And is there a point at which fertility patients should consider stepping up to advocate for themselves to have more testing? Or what other steps can they take?
It can be really helpful to see a genetic counselor who does this. So most prenatal genetic counselors will also do preconceptional appointments where they do take a detailed family history, and at that point a patient can ask for a proactive test as well. And it's actually very new. Like this testing wasn't even around a few years ago. So the fact this is available, not only is it going to be helpful now, but the number of genes on it will increase in the future, and the availability of it and the clinical action plan that would change because of these genes will be different as time goes on. If somebody is going to undergo or going through IVF, that asking to see a genetic counselor or finding a prenatal genetic counselor to talk about this with before they go through the process can be really helpful.
What I find sometimes patients who are in, let's say, a large HMO network, they go to the genetic counselor hoping that by seeing the genetic counselor, then the testing will get covered. But the genetic counselor has a checklist and they say, oh, you don't quite qualify for testing. We're not going to cover it. And that for me gets a little frustrating because I'm hoping that I don't have to pay for it. But I think you mentioned the price point for some of these tests, and it seems like it's pretty reasonable.
Yes, it is. Only a few $100s. And if you think about, what all the costs with IVF, it's actually a really small cost compared to what you're paying to be on this journey. There are some systems that have very strict criteria, but if you ask and you say, I really want this testing and I don't mind paying out of pocket, then that's a type of self-advocating that can be really helpful.
If you had a magic Dena DNA wand and you could just, wave it over all the fertility clinics in this country and world, how would you change things?
Okay, number one, I think all fertility clinics should have maybe a genetic counselor or somebody who's trained in taking a comprehensive family history. So sometimes there's just the only family history that gets taken is on the questionnaire. And these questionnaires are long and people don't always fill everything out, or they don't always take the time to ask their family members this information. And so what I found is when I am doing a session, that oftentimes people left out things or forgot things on the questionnaire. And so to only rely on this questionnaire, it's going to miss some people. So like in if I had this idealistic system, it would be having somebody do more of a comprehensive family history, offering an extra proactive panel for people that may not know their family history or just for anybody that's interested in it. I think that we would catch a lot more of these single gene adult onset conditions that way and then be able to act on them.
And then what about for egg and sperm banks? I mean, I think, if anyone takes something that's a little bit more limited, sometimes I see that happening, let's say with fresh egg donors. They're not getting an extensive family history done. Some agencies are definitely working with great genetic counselors, but not everybody. So, how do you think things could be better from that standpoint?
I love the agencies that do work with genetic counselors because I know a lot of my colleagues that work for these companies or organizations. They do a pretty good family history. I know because I've talked to some of the sperm banks and donor banks that they feel that if they do too much genetic testing, it will weed everyone out. And so to me, that kind of freaks me out. Like as a patient, I would want as much information as I can. Not everybody does, but I would. And so I think it would be to be in touch with the donor themselves because you can't really test the embryo for. I mean, you could test for conditions, but you probably wouldn't want to screen these embryos for all of these conditions. It's easier to test the donor themselves. And so to stay in touch with the donor and to either offer a lot of this testing up front or to, if somebody asks for it, the availability of them to undergo this testing so that the recipient can have that peace of mind.
And what about for patients who are using a donated embryo? Are there any special considerations for testing for them?
I absolutely think that they should be able to ask the agency that's connecting them to the donor for the very minimum carrier screening, but also to make sure that that family history was taken and to make sure that if there was a family history taken and there's anything suspicious that they were tested for whatever, their heart disease or neurological condition. So that's a very minimum. But I think maybe in the future, as this testing gets more available, maybe they'll start to do these proactive panels on and to just to screen everybody that's going through because these are significant syndromes that we can test for.
I offer proactive testing to all my patients that are using fresh egg donors because they're accessible, they're available, and I can do that testing. But otherwise, it's very hard to do. But that's a good point. So for people who are using a donated embryo, if the donating family is available, maybe that's something that people should be asking as well. So, Dina, I love what you're doing. I love your message. I love how passionate you are about genetics. Clearly, we are on the same page about being passionate about what we do and love doing it. So, if someone would like to work with you, where can they find Malibu Genetics?
Great. Yeah. So it's malibugenetics.com. And I can see any patients in the state of California and also in several other states. And I'm working on getting licensure in even more states. So if you go to malibugenetics.com, you can check to see if I can see you depending on what state. So I do mostly telemedicine, meaning using Zoom to see patients, but I also offer house calls if you're in the Los Angeles area.
So, what is the pre-IVF genetic counseling and testing package?
Yeah. So the first thing is making sure that they've had adequate carrier screening. And the second thing is doing a family history of both the person giving the sperm and the egg. And then, if there's anything suspicious, doing a diagnostic test to see if there's something running in their family. If there isn't something suspicious, or even if there is, also offering that proactive panel. So it's kind of this holistic view of things that are actionable that the person themselves may not be affected with, but that we can use um, that knowledge to really inform their care and their testing once they go through the IVF process.
So that brings me to this question. If, let's say, someone doesn't have a doctor that's going to offer these tests to them, can they do them through you?
If I am licensed in their state or I can see them, then absolutely. So that's That's what the pre-IVF package is, and I'm happy to work with patients on that.
That's excellent. Awesome. Well, that's great to know. That is super. That people who want to advocate for themselves and maybe aren't getting the response that they need or want from their medical team, then they can go to you as their genetic counselor to help them with all this information.
Absolutely. I am a big fan of being your own self advocate because unfortunately, you need to be, right? In our healthcare system, actually, in any healthcare system, you're the one that's going to look out the most for you. So if somebody is self advocating, I am just their biggest cheerleader for that.
And then people can also watch you on TikTok.
Yes, yes. I have outside of Malibu Genetics, I also am, like you said, Dena DNA. I like to teach people about genetics and genetic testing and genetic counseling in a way that's really fun. But yeah, you can follow me on TikTok at Dena DNA. I'm also on Instagram, Facebook, YouTube. I have a little YouTube series where I do my own animation. So I kind of animate these concepts because I'm a very visual learner.
Thank you again, Dina, for coming on and sharing your passion for genetics and for changing the world for each patient, one patient at a time. Thank you again.